I'm Janaea, and today I'm going to demonstrate how to dilute an IV med for administration by CIVA pump. So first off, I would compare my MAR to doctor's orders, make sure we have right patient, which we do, and we have the right drug, which we also do, right dose, right route, right time, and all those things line up, so we're good to go. So I'm going to pull my medication out of Pyxis here. Alright, and I'm going to do my first check. So you want to make sure right patient, Emma Wrighton, good. Finn, 1, 2, 3, 4, 5, 6, 7, 8, 9, good, 30 years old, physician, Dr. Nichols. Alright, it's all good. For allergies, we have strawberries, which isn't a contraindication with this drug, but just something to keep in mind. So we have our drug, methylprednisone, that's good. Our dose is 100 milligrams. The vial is 125 milligrams, so that falls in that. It's supposed to be given IV, and this says it's for IM or IV use, so also good. And every 6 hours. It was last given at 6, so we're good to give it now at 12. Yeah, and the drug is not expired. So we're just going to flip here to our monograph. It says it can be given by a student nurse, so we're good. I'm giving this medication because my patient's having an inflammatory response to allergic reaction, and this is a steroid which helps reduce inflammation. The usual dose is 40 to 250 milligrams IV every 6 hours. My order is 100 milligrams IV every 6 hours. So it fits in that. Maximum safe dose is 30 milligrams per kilogram, so we easily fit into that. Alright, so now we're ready to dilute. So it says for 125 milligram vial, we need to add 2 milliliters of sterile water. Since we're using CIVA pump, I'm going to use normal saline, which is a compatible substance to use with this medication. So, pull out my normal saline here, and we're just going to swab both of these vials here for 30 seconds, and let dry for 30 seconds. Do this too for 30 seconds, and let dry for 30 seconds. Alright, so we're going to grab our 3 milliliter syringe, and we will draw up our normal saline. So, again, we're drawing up 2 milliliters of our normal saline. I'm just going to pull this back with air, just so we can counteract the negative pressure. So I'm just going to draw up 2 milliliters here. I'm just going to get rid of some bubbles, so we make sure we get the correct dose here. Looks good. Okay, so I'm at 2 milliliters here. So I'm just gonna remove the vial and inject it into my medication vial, which we already swabbed. So it's clean. Alright, and I'm gonna pull out some excess air just so we don't lose medication because of the pressure. Alright, and then I'm just going to roll this between my hands slowly just to make sure the medication is mixing and dissolving. Alright, that looks good. So, now for my calculations. So we have a 125 milligram vial, which is 2 milliliters volume. I want 100 milligrams, so I'm going to need to draw up 1.6 milliliters of the drug. So I'm just going to pull this back, 1.6, and this was already cleaned, so we're good. I'm going to inject the air again, and I'm going to pull up my dose of 1.6. Okay. get rid of some bubbles here. Draw it back up to the correct dose. Alright, and that looks good. So we're going to pull this off. And I'm just going to recap my medication here. Okay, so now I'm just going to do my second check. So flip back here to my MAR. I want to make sure I have the right patient. So Emma writes in, good. The right drug, so I have methylprednisolone. Look back here on my vial. Methylprednisolone, good. 100 milligrams, I know that is 1.6 milliliters. So I'm going to look on my syringe here, 1.6 milliliters, good. IV, this will be going through her IV every 6 hours, and 6 hours has passed since the last dose, so we're good there. Yeah. So now I'm going to dilute my medication here. So again, we're going to turn to my CIVA monograph now, and it says for methylprednisolone for a dose of 100 milligrams, we're going to need to dilute 10 milliliters in a 10 milliliter syringe. So I have my 10 milliliter syringe here, and I'm just going to grab my blank fill, making sure not to touch the end, maintain sterility. And I'm just going to grab another normal saline just in case there's not quite enough in that one. Hi everybody, my name is Lee. And I'm just going to swap top for 30 seconds. Let it dry for 30 seconds. Alright, and I'm just going to inject 10 milliliters of air into my vial.
I've already obtained my medication from the Fixus machine, so I'm going to go ahead and perform my first check.
And I'm going to draw back my normal saline.
Is in our facility for acute exacerbation of an asthma attack, and is required.
And I'm just going to get rid of some bubbles here. Okay, and that looks good. And because we want 10 milliliters of normal saline in our, or 10 milliliters total volume in our syringe, and we have 1.6 milliliters already of medication, we're only wanting to draw up 8.4 milliliters of normal saline. So I'm just going to pull back until we get to 8.4. Alright, there we go.
To my parenteral drug monograph to ensure that as a student nurse I can give this medication.
Okay, there we go.
I'm also going to make sure that the dose is safe and within a normal range.
So I'm just going to recap this. Okay, and now I'm going to pull back my syringe so it has room for when I inject my drug. I'm going to remove blunt fill, throw this in sharps, and I'm going to pull this off without touching the end. Okay, and I'll inject this. Again, I'm going to cover this up. This would go in sharps.
The top
I'm going to readjust my dose. And there we are. There's no bubbles. We're at our 10 milliliters. I'm just going to cap it just to make sure that it's, this doesn't get contaminated. Okay. There we go. And then I'm going to write up a label. So we have patient's name, writes in Emma, the drug, methylprednisolone, dose, 100 milligrams, volume 1.6 milliliters, diluted normal saline, concentration per ml, 10 milligrams per ml.
So this vial should normally
Date and time, October 19th, 2018 at 12 o'clock is the time. Signature. Okay, and then I'm going to attach this to my vial here. Okay, now I'm ready for to bring this to my bedside here. Okay, so come into the patient's room. I'm going to do a safety check right away. I'm looking that side rails are up. They're not right now. They should have been. The IV, primary line, D5W, and normal saline is running good. No bubbles in the line. And the IV site looks good. Looks healthy. So I'm just going to check the wristband here. So their wristband says they're allergic to strawberries, which I knew from my MAR. And I'm just going to check the wristband here. Okay. Hi Emma, can you tell me your name? So Emma writes in good. The FIN number is 1, 2, 3, 4, 5, 6, 7, 8, 9. It's same on the MAR. And how old are you? 30, 30, good. All right, and the physician, Dr. Nichols, and Dr. Nichols. Okay, so we're good there. Yeah, I'm just going to do, so hi Emma, I'm Janaea, I'm your nurse. I'm here to administer your IV steroids to help with your allergic reaction. All right, so bring this closer. I'm just going to perform some hand hygiene here. And we're going to do our third check before we hook it all up. All right, so Emma writes in. Again, check the wristband. Emma writes in. So same, the right patient. FIN number 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 5, 6, 7, 9. 30 years old. 30 years old. Awesome. Allergy strawberries. All right. So the drug, we have methylprednisone. Our dose is 100 milligrams. 100 milligrams IV. Good. Every 6 hours. Again, it's been 6 hours since the last dose. Our volume should be 1.6. So that's the amount we put in here. We dilute normal saline, and our concentration is 10 milliliters per milligram. So there's 100 milligrams in the 10 milliliters. Yeah, again, right time. Good. Okay. So now before we attach it to pump here, I'm just gonna prime the line. Get this. Okay. So I'm just gonna take off the cap without touching the top here because we want to maintain sterility. Something we'd want to consider before giving this medication is if they had a serious infection, because that would implicate the medication, as this medication lowers your ability to fight off infections. Alright, so I'm going to make sure the clamp's open here so I don't have a occlusion, and I'm just going to push, loosen the cap a little bit. I'll just push a little bit of fluid through until, alright. And there is no bubbles in here, and I see the little bleb on top, so we're good to go. And I'm just going to recap the top just for now, so we don't get it contaminated. And I'm going to attach it now to the primary line. I know that it's compatible with the D5W and 0.9 normal saline because I checked on the monograph. I'm going to choose a Y port below the pump so that the CIVA pump is going to be regulating the flow and not the Baxter pump. Alright, so I'm just going to swap the port here. Okay. I'm going to do this for 30 seconds. Let it dry for 30 seconds. Alright, and then I'm going to attach my line to the port. Just drop that. Okay, so I'm just gonna make sure it's on nice and tight. And I'm gonna just put this up in my pump here. Okay. I'm just gonna bring this down and just recheck my CIVA chart, and it says it should run at a normal speed. So I'm just going to press start normal speed. Make sure it's going, and everything looks good. So I would document my medication being given, so 12 o'clock. Good. So once this is finished, I would put a flush of normal saline in here, just to make sure that no medication is staying in the tubing. And I'd want to tell my patient, if you're experiencing any headaches, nausea, skin discoloration, just pull your call bell, which is right here. Let's pretend it reaches the patient here, and I'll come check on you right away. So otherwise, I'll be back to check on you in about 15 to 20 minutes. All right. And then that is all.